Good morning, everyone. Phil Penarski here with CBS 42 Now. Hope you're all having a great start to your day. We are just a few moments away from hearing from UAB doctors regarding what they're seeing as it relates to the latest on the COVID-19 pandemic, specifically at UAB as far as it goes with hospitalizations as well as vaccinations. It appears that the doctors are ready to speak, so we will send you there live now.
And hospitalizations as well as total cases. Deaths are slowly improving, although it's much slower, and that's as what we would expect. It tends to be a lag. In terms of UAB, we are seeing a slow, stable downtrending of numbers. We did see a slight uptick in the past couple of days, but that's overall about stable in comparison to the week prior. Russell, I'm going to hand it over to you to see if you have anything else to add.
Yeah, I mean, just the uptick we've seen the past couple of days, it's actually following a pattern that we've seen where every 7 days we just have a slight uptick over the weekend. And then we continue on our general trend downwards as we decrease in our COVID census in the hospital.
All right, thank you. We will go ahead and move into our questions. Alan, I see you have your hand raised. Do you want to go ahead and unmute and ask your question?
Yes, the question I would have is talk about the hospitalizations you're seeing. Last year with hospitalization, it was older people with health conditions. Talk about, I guess, mainly you're seeing younger people and why we're seeing so many younger people now.
Yeah, I mean, I can definitely comment on this. We are definitely seeing a younger population, and our average age of our COVID patients during this current wave is about 10 years younger than what we saw in the holiday wave. And there could be a number of things that are driving this, but one of the main things is that in Alabama, that we have a lower percent of our population that's vaccinated. Our older population, age 65 and older, actually has a very high vaccination rate. It's about 75% when we began this wave right here. And so it's not surprising to me that we see a younger population just because our older population is vaccinated. And those who are vaccinated that we see coming in, they are older. About half of them have an immunocompromised condition.
Can you, you may not know this unless you deal with them personally. Do you see they're unvaccinated? Do they have a change of attitude, or do they have the attitude, I got it, I now have natural immunity, I don't need vaccines?
No, I don't think I can comment for every single patient, but I can tell you that I was recently on service in September, so at the height of our surge. And unfortunately, most patients, by the time that I was seeing them, couldn't even tell me how they feel because they're intubated. So they're on a ventilator and they are incredibly sick. And it's heartbreaking to see patients who are younger than yourself, who have no comorbidities, struggling to breathe, and then ultimately dying from something that is now preventable.
All right, thank you. Muriel, would you like to ask your question?
Yes. Hi. Dr. Lee mentioned this, but both of you could answer if you want. With the downward trend that we're seeing with hospitalizations and even the number of new cases, are you all anticipating that to uptick again, or are you thinking we're going to kind of stay that way for a while? What are your thoughts for the future?
I think I can start with that. It's an interesting question about why we see waves in a pandemic. And, we've seen this with other pandemics in the past, that once you start with a wave, it's about 2 to 2.5 months. This Delta one has been about 2.5 months rather than 2 months. And so it's just a very long period of time where we see cases and then it starts to drop. So what makes it drop? There are a lot of questions and we actually don't know the reason that it starts to drop, other than potentially, people start changing their behavior. Maybe we're seeing a lot more natural immunity that goes through a group. And so with that in mind, Dr. Griffin and I have actually had conversations about whether or not we will see a surge. And so I'm going to let him kind of talk about his thoughts of the potential for a holiday surge.
Sure. Thank you, Rachel. So one of the things to consider when we talk about the different surges is that it doesn't really seem to be much of a seasonality to this. With the flu that we have, there's a legit seasonality, and we see it between October and March or April every single year. We can kind of predict what's going to happen with the flu and get the vaccinations correct based upon what's happened in the Southern Hemisphere, because they also have their flu season while we're having our summer season. And it doesn't seem this is going this way with COVID. One thing that happened last year around the holiday wave is that we were just ending that first initial wave, which went from about April through July and kind of was petering out around August and September. When around October is when we started to see that the cases began to tick back up. And part of that could have been because of the alpha strain, the variant that we saw, which kind of took over during the holiday wave. But currently, if we look at the variants of concern, the variants of interest, the variants being monitored, and so a variant of concern is one that has a high potential for spread. Variant of interest is one that has a high potential but isn't currently circulating very high, and a variant being monitored is one that's just not circulating hardly at all. And when we look at those, the variants of concern by the WHO and the CDC here in the United States, it's just Delta. And here in Alabama, we just are ending or finishing up our Delta wave. And there's really no other variants that are out there. We do have Lambda and we do have Mu. There's some news reports that came out a week or two ago that said that Mu was effectively eradicated in the United States because of how quickly Delta spread throughout the United States. And so whether or not we have a holiday surge is going to be really dependent on two things. It's going to be dependent on, is there another variant that pops up in which people are susceptible? And it's also going to be dependent on the natural immunity to SARS-CoV-2, the virus that causes COVID that Rachel had mentioned. And so with that in mind, if we had to kind of guess or predict what would happen in the holiday waves, a good educated prediction would be that we may see a surge, but we may not see a surge to the magnitude that we've seen with the current Delta wave, just because not only do we have the vaccinated, we're getting boosters for people who are eligible, the older population. So last holidays when we had that 65 to 70-year-old population in our hospital, they are hopefully getting the boosters right now. And in addition, since we just finished this Delta wave, this large Delta wave, that we may have a large pool of our population in the state which have natural immunity to SARS-CoV-2.
All right, thank you. Alan, would you like to ask your question?
I guess it does follow up on the heels of what Dr. Russell was talking about there. The fact that head of the FDA saying this week he believes we're seeing the pandemic wane now. Do you believe that we are at that stage? He thinks the wave is definitely going down, and he said going down and waning. Do you believe we are at that stage right now?
I think potentially. Oh, go ahead, Dr. Griffin.
I was going to say, I can say for our state, we definitely are coming down on the Delta variant. For the short term at least, it will wane. But again, the question is, what's going to happen with this natural immunity? What's going to happen with the future variant?
Yeah, we have some really hopeful things coming in through the pipeline. So we have a new medication that may help with the treatment of SARS-CoV-2. It's an oral pill, which is exciting in the sense that, we don't have to have a patient come into the hospital to get the medication. So we also have, people in line getting booster shots. There's also going to be Moderna talking about booster shots to the FDA, and then J&J following that, I believe, mid-October. And then also exciting for myself, for ages 5 to 11, they're going to be talking about Pfizer vaccination through the FDA at the end of the month. So I think if we get more people vaccinated, more people covered and protected, and hopefully we don't see a new variant of concern pop up and kind of take hold like it did with Delta, then yes, I would say that there is a potential that we are kind of on the tail end of this pandemic. But I really am very careful to say that we've won when I don't feel that way right now.
Do you have any fears that people's behavior is going to change dramatically and will impact that greatly in the coming weeks here as we see the numbers go down? They say it's over and they start acting. What are your fears?
I think that's our fear that we see with kids in school systems, right? We know masks work and masks work well, but the moment we kind of lose sight of that protection and maybe kind of ease up on what we do to protect ourselves, we can see cases start again and new waves occur or outbreaks occur. And so I think right now it's exciting that we're starting to see these numbers go down, but this is now the time more than ever to continue to wear masks, to get vaccinated if you haven't been vaccinated yet. Talk to your healthcare provider because they are here to help you through your questions that you may have about vaccination.
All right, thank you. So when you look at this data, and I know y'all have mentioned that we are on the back end of this wave, Why do you think that more people don't get vaccinated, even when it was clear that being vaccinated significantly reduced someone's chance of being hospitalized, especially due to the Delta variant?
Yeah, I think it's multifactorial. So I don't like to brush everybody with the same paintbrush, right? It's when I talk to my patients, everybody has a different view as to why they may not have gotten vaccinated, and it takes time to talking to them. Recently, I talked to a patient this past week who had heard so much different information from media that he was quite confused about whether or not the vaccine was truly safe. So it takes time to be able to talk to patients and go through their concerns. The other piece to this, and I think Alan was mentioning this, is about this view that natural immunity is just as good as vaccine immunity. And we don't know that. We have a recent study that came out in Lancet that said it's highly variable. Some people's immunity lasts 3 months, some people's immunity lasts 15 months. And with that variability, it's hard for me to tell a patient who's had COVID that they've got the right amount of antibodies to protect them going forward. I will also say is natural immunity is like the school of hard knocks. You are sick, and there are a lot of people that deal with long COVID, and that is much harder to deal with, that morbidity associated with it, long symptoms, neurologic symptoms, brain fog, fatigue, shortness of breath that can last for quite some time. And so if I had to choose between natural immunity, where I have no idea how I'm going to respond to COVID, versus a vaccine where I have very clear data of the side effects of those vaccines, the vaccine is where to go.
Okay, Ayana, would you like to unmute and ask your question?
Yes, thank you. Just really quick going off of that. So I talked to someone the other day, and they said that most people who want the vaccine have already gotten it. So the mass vaccine clinics and those big events aren't really working anymore. They're looking at like churches and smaller events. Can y'all comment on that from what you've seen?
I don't know the exact numbers offhand of our Hoover site. Hannah, do you happen to know how many vaccines we've been given? I think we've given a fair amount through our drive-through vaccination site just in the past week.
Yeah,
go ahead, Hannah.
I will drop the update that we sent out on Monday of our vaccinations.
But my personal view is that, a drive-through testing site was great in the beginning. It's also great to reach people, especially during this time when we were thinking that we need a lot of booster shots. So I think those are very helpful, and potentially maybe considering it a drive-through site for kids when that becomes available as well. Anytime that you have a large group of people that need to get vaccinated. But I agree with you completely that also having pop-up clinics at churches or at community centers, anywhere where we can reach people that may not have that access is key there.
All right, thank you. So going back to, we are seeing a downtick overall with the Delta surge, but we still have a lot of people in the hospital. How long do you think that hospitals are going to be dealing either with, active COVID patients from the Delta surge, or even those that are no longer active but convalescent and still needing to be hospitalized?
So I can comment on this. So we compare the holiday wave to the current wave. They're very similar in shape when we look at statewide hospitalizations. And that holiday wave took about 2 months from the peak around early January until we got statewide very low numbers of hospitalizations around March 1st. And so it's probably going to be very similar to this. We were fairly low in statewide hospitalizations. I think we're at about 200 or 250 right before this Delta wave really started hitting in July. And so it's probably going to be very similar to what we saw in the holiday wave.
Just talking about the holiday wave, what have y'all noticed is the most significant difference between 2 hospitalizations during this wave and then during the wave, kind of the holiday wave, the January wave?
So, just mimicking what Dr. Griffin has said, we are seeing a large amount of people who are not vaccinated, so about 85% to 90% or so. And those who are vaccinated are actually much older, on median age of about 68 years, compared to 50 years who are unvaccinated. That's a large difference. And so about half of those fully vaccinated individuals are immunocompromised. They have multiple comorbidities, whereas the younger unvaccinated population typically do not. So there's a very different spread between vaccinated and unvaccinated individuals hospitalized at UAB. But despite that difference, that main difference in age, main difference in comorbidities, we're seeing the same rates of really requiring ICU stay and death. And so younger people are dying, and that is what is scary to us. And that, as a healthcare worker, it's devastating to see someone so young dying.
Yeah, I mean, and to echo that point, we're also seeing for these younger individuals during this wave, the same rates of being placed on mechanical ventilation. And when we think about it, and people think about outcomes for COVID, I often get asked, well, what's the death with outcome? What's it look like for the deaths? And that's really just the tip of the iceberg, because we have these patients that are in the ICU for 2, 3, 4 weeks. They're on mechanical ventilation for 2, 3, 4 weeks. And even if they survive, it's not a short recovery to recover from being in the ICU for so long, for being on invasive ventilation, to be intubated for weeks at a time. And that's kind of the part that it's not discussed too much.
Kind of going off that same thing, what are the differences that you are seeing in the convalescent patients? So the patients that came in with active COVID no longer have active COVID, but are still in the hospitals. Are they requiring longer stays? Are you seeing any kind of long-term or more long-term issues or different long-term issues? What are you seeing with the convalescent patients?
So the convalescent patients, the patterns are actually fairly similar to the comparison when we compare the current and the holiday wave for convalescent as it is for the non-convalescent patients. It's younger individuals. The length of stay is around about the same. The number of days on mechanical ventilation is the same. The number of ICU days is the same as during the holiday wave. And so there's no real difference in that aspect. And the only difference that we're really seeing that is impactful is, as Dr. Lee said, it's those younger individuals with no comorbidities that are being placed in the ICU and being placed on mechanical ventilation.
Okay, and then I know that because we are starting to see a downtick, and like I mentioned, people feel like everybody who wanted to get the vaccine has gotten the vaccine. What would you say to people who they're seeing the numbers go down? Like you said, there's no kind of imminent new variant like the Delta variant. What would you say to those people and the importance to still get out there and get vaccinated?
I mean, this is the time to do it. Absolutely. If there's no other variants around, right now is the time to get vaccinated, because the longer we allow more variants the chance to form, the longer this pandemic is going to be spread out. And so if we can get people vaccinated, if we can prevent another variant from forming just because someone's been infected and it stays around in the body for a while and that new variant forms, then we can stop this pandemic.
And I would say for people who have had COVID and have recovered, I'm really happy that you're doing well. I would say at this point now is the time to think about getting vaccinated if you haven't already done so. And the reason for that is, we really don't know the level that our antibodies need to protect us from further infection or breakthrough infection. But what I can tell you is that if you've had COVID and you get vaccinated, the amount of antibodies that you produce is sky high. It's almost 3 times higher compared to a person that hasn't had COVID that gets vaccinated. So if you really want to protect yourself even further and not have to deal with that infection again, go ahead and get vaccinated.
Thank you. Alan, would you like to ask your question?
Basically, sort of trend what we've been talking about. Do you believe Thanksgiving, Christmas, this is basically over? And another question, maybe unfair, but I'll ask it anyway. Some people talk about people getting vaccinated. We're kind of where we are. It's trickling in, it's going in. And such, but the way to go for the future to really beating this will be mandates.
Well, I think, Dr. Griffin and I, you can't ask absolute questions of us because we won't give you an absolute answer when we can't predict the future. I think the biggest thing here that everybody needs to hear right now is how do we get out of this pandemic? And that is through masking, and that is through vaccination, and that is staying home when you're sick. All of those things that we do as a community is what's going to help us have a safer and happier holiday. It was very hard last year during the holidays to not be able to see our loved ones. And what we want, and myself included, is to be able to have friends and family over and to not worry about COVID-19 and to not worry that, hey, was this person exposed? Can I allow them into my house? What about my kids? And so we all have to do our part to be able to have a safe surge or a safe holiday and not have a surge.
All right, I echo Dr. Lee's sentiments. I mean, it's really difficult to be able to predict the future. I can provide you situations and say, well, if this happens, then this is what potentially could happen, or if this route goes, this is what could potentially happen. But really, the way to actually have a nice Thanksgiving and a nice Christmas is actually just to make sure that everyone has the protection they need from this virus to prevent its further spread.
I think, Alan, to your second question about mandates, right now, we know vaccination is one of the best methods to preventing getting infection. And as a clinician, as an infectious disease doctor, I want my patients to believe in what they're doing. And so I'm 100% about education, and I want people to be on the same page with me. A mandate, from a healthcare system standpoint, there are a lot of healthcare systems that have recommended mandates, and that's because we as healthcare workers are constantly exposed. And so, I'm not going to comment about, whether or not mandates are politically okay or not, but what we can say is that we know that vaccinations are one of the ways to get out of this pandemic.
Thank you. Does any media have any other questions? Real quick. If not, we'll go ahead and wrap up. Dr. Lee, I was going to give you a second for any closing remarks.
Yeah, I just want to thank the media here. I feel like y'all have done really well to push out the truth and to try our best to try and find answers when we don't have them. I hope that people understand that because we're in a pandemic, we're constantly learning new things and trying to find ways to get out of this. And so I feel that everybody's getting a taste of the scientific method with, here's a new drug, here's a new study, and it almost seems overwhelming. So to the general public, I would say, focus on the things that mask up, get vaccinated, stay home if you're not feeling well, and through this together, we'll get through this pandemic.
Thank you. And Dr. Griffin, any last words?
That's always, Dr. Lee has summed everything up perfectly. One thing to tell the general public is that one study doesn't prove anything. It's really the collective in which helps drive the scientific method. And so that's why you may see one study that says one thing and another study that says perhaps something completely opposite. And so as professionals in the medical field or in the public health field, we take the collective to really help guide our decisions of what's going on with this pandemic. And that's why it seems like our views are always changing. They're not. They're just following what the evidence has provided to us.